Hello and welcome to our Hendra virus presentation by Soraya Kim, Tori Kuchke, Isabella Kodasek, Hannah Kress and Bree Lambert.
Hendra virus is an RNA virus formerly known as equine morbillivirus. It was first discovered following an outbreak in the Brisbane suburb of Hendra in 1994, which caused the death of several horses and humans. The unique characterization of Hendra and its close relative Nipah virus led to the creation of a new genus, Henipavirus, in the family Paramyxoviridae. Australian flying foxes of the genus Pteropus are the reservoir for Hendra. Hendra has been responsible for the fatalities of over 100 horses, 2 dogs and 4 humans.
Hendra virus does not appear to cause disease in the natural flying fox host. However, horses and humans tend to exhibit either or both neurologic and respiratory disease in varying severities, often resulting in death. Initial replication in the nasopharynx, followed by systemic spread to the brain, lungs, kidneys and heart, results in variable clinical manifestations of disease. Clinical signs of infection in horses can include any combination of respiratory distress and neurological signs such as aimless pacing or circling, head pressing, intermittent recumbency, muscle tremors, ataxia and facial nerve paralysis, and also systemic features of disease including anorexia, depression, pyrexia, stranguria, which is pain during urination, oedema of the head, hemorrhagic nasal discharge, and often rapid death. The incubation period is typically 8 to 11 days, though it has been suggested that horses may be infectious even 48 hours before clinical signs develop. Infected humans can exhibit anything from mild flu-like symptoms to acute or relapsed encephalitis and death. A frothy nasal discharge has also been observed in almost all natural mortalities caused by Hendra virus. Several animal models have been experimentally exposed to Hendra virus, including ferrets, African green monkeys, golden Syrian hamsters, cats and guinea pigs, all of which display variable combinations of the clinical features mentioned. It has been suggested that the variation in clinical manifestations of disease could potentially be owing to the route of infection, dosage or strain of the virus, as well as host-related factors.
Hendra virus invades respiratory epithelium via membrane fusion and a form of endocytosis. This is facilitated by viral fusion proteins and glycoproteins, which allow the attachment of the virus to host cells within the lymph nodes and the liver. Non-structural viral proteins enable evasion of the innate immune system through the interference with cellular signaling events and the synthesis of interferons. The viral genome is released from nasal tissue via budding, and clinical signs can then develop once the virus infects the bronchial epithelium. This is followed by systemic infection and signs of viremia and pyrexia. So here we have a histological section of lymph node from a horse with acute Hendra virus infection, and we can see giant cells with round pink intracytoplasmic inclusions, and these are called syncytial cells. And we can see that a lot of the inflammation accumulates around the bronchial and pulmonary arterioles, and this is due to neutrophils and T cells going to the site of infection. Hendra virus can present as peracute or acute infection. Post-mortem examination of peracute cases often don't show any obvious signs of infection. In contrast, acute cases display manifestations such as pulmonary edema and congestion with blood-tinged foam in the airways, dilation of pulmonary lymphatic vessels, hemorrhage below the pleura, congestion of lymph nodes within the abdomen, and enlarged submandibular, sternal and bronchial lymph nodes. So this histological section is showing the interaction between the anti-Nipah and antibody and the Hendra virus antigen in a section adjacent to the lymph node. On post-mortem, it is common to find death of lymphoid tissue and alveolar tissue. Animals that exhibit neurological symptoms prior to death have inflamed meninges and enlargement of glial cells on post-mortem. Vasculitis affects the smaller blood vessels that may be found within the lungs, meninges, lymphoid tissue, kidneys, female reproductive tract, nasal mucosa, adrenal glands, liver, heart, and the gastrointestinal tract. The persistence of viral fusion proteins on the surface of infected host cells leads to the formation of syncytial cells, which further spread the viral infection. This is visualized upon histological investigation within the kidneys, lymphoid tissue, vascular endothelium, lymphatic endothelium, and in the lung.
There are broad ranges of diagnostics available for the detection of Hendra virus. Due to the zoonotic potential of the virus, strict precautions must be undertaken during sample collection. In a live horse, blood and EDTA as well as nasal, oral and rectal swabs can be collected for PCR. Necropsy should be conducted by an experienced and suitably equipped operator. If not, risk reduction measures should be taken, such as only collecting the superficial mandibular lymph in addition to blood and swabs. Samples and cultures should be handled within BSL-4 conditions. Here are the tissues that the virus should be sampled from. Virus isolation is a valuable primary diagnostic tool. Post-mortem samples are serially suspended, centrifuged, and the supernatant is used for inoculation. In a diagnostic setting, they are propagated in virus cells for this isolation, and CPE is developed within 3 days if the subject's positive. The figure on the right shows the image of virus cells when infected with Hendra virus. Immunohistochemistry is a safe and effective test for Hendra virus. Its particles invade the vascular endothelium, which means that the viral antigens can be found in sample from a wide range of tissues. However, collection of the spleen is very important, as the virus isolates in the spleen of a horse 21 days post-infection. Anti-rabbit or anti-mouse dextrin polymer linked agent conjugated with alkaline phosphatase is regularly used in detection. Here, you can see the necrotizing bronchoalveolitis with epithelial syncytia in the lung of an infected ferret. Image A shows the H&E staining and B shows the immunohistochemical staining of N protein of the Hendra virus. Electron microscopy provides visual information about viral morphology and virus-antibody interactions. This method classifies the virus as belonging to the Paramyxoviridae family according to its structure of the nucleocapsid. It also identified the distinctive double fringe surrounding the envelope viral particles particular to this virus. This is the micrograph of a Hendra henipavirus virion. PCR is favored due to its speed, specificity, and sensitivity. PCR involves the coding of the nucleoprotein N gene, which is significant to the members of the subfamily Paramyxoviridae, or the M gene, which codes for the matrix protein in the genus of morbilliviruses. Several cycles of PCR is required to eliminate false negative results. Serum neutralization tests using neutralizing antibodies is the reference standard to confirm diagnosis. Unknown serum samples are incubated with the virus and added to virus cells in dilution. After 3 days, positive sera will completely block the development of CPE in the culture. In neutralization tests, antiviral particles are added to blood samples containing a virus, which neutralizes the virus and inhibits hemagglutination, as explained by the figure on the right. ELISA enables to conduct safe, rapid, and specific tests, even without an access to PC4 facilities. Indirect ELISA can be performed for the detection of IgG and a capture ELISA for IgM. The lysates of the infected cells are prepared using non-ionic detergents and virus-specific material shared from the cytoskeleton. The nuclei are also removed through centrifugation with antigens irradiated for safety. Figure A shows the immunoblot of Nipah virus N protein. Figure B shows the electron microscopy of an inclusion body fraction of its antigen. Figure C is a Kumasi staining of purified recombinant G protein elution fraction of Hendra virus and Nipah virus.
The epidemiology of Hendra is related to the ecology of Australian flying fox hosts of genus Pteropus. Whilst all 4 species in this genus can be hosts to the virus, P. conspiculatus and P. electo are the primary reservoirs. Infection cycles are characterized by spillover events, where the pathogen moves from flying fox populations to infect horses and sometimes humans. Spillover events can be tracked by examining pulses of Hendra in the flying fox population. Availability of food, particularly eucalypt nectar, is a key driving factor in Hendra pulse intensity. Eucalypt nectar availability largely depends on climate, and when low, flying foxes aggregate and move closer to human settlements where cultivated fruits are available. Low food availability leads to immunodeficiency and lower body condition scores, causing further rises in pulse intensity. Climate change will alter the flying fox's natural range and decrease food sources, increasing the risk of transmission. Whilst the current range of the 2 highest risk species is confined to northeastern Australia, this is predicted to move further south towards Victoria and southern New South Wales. The other 2 species have ranges further south, with some settlements in South Australia and even Tasmania. Greater overlap of all 4 species risks even wider spread of Hendra. Juvenile flying foxes maintain the population levels of Hendra virus as their maternal antibodies wear off, causing a cycle of infection within young animals. Pregnant and lactating flying foxes have been associated with higher infection rates. As human populations sprawl outwards from urban centres, the associated deforestation and climatic conditions cause flying fox populations to become fragmented and concentrated. Movement of Pteropus species closer to human population also poses a problem for further species involvement, such as domestic cats and dogs, as well as production animals, such as pigs.
Prevention of Hendra virus is important as treatment has proven difficult. The most effective preventative methods are good biosecurity practices and vaccination. As Hendra virus is a zoonotic disease, personal protective equipment is vital for humans that are treating or in contact with suspected cases. Biosecurity practices involve the use of PPE such as gloves, overalls and masks. Also, disinfecting equine or medical equipment, housing and any tools in contact with the affected animal using Category A envelope virus disinfectants. Examples of Category A disinfectants include soaps, detergents and hypochlorites. Sick horses should be isolated even prior to Hendra testing to reduce the potential spread to other horses on the property. Transport to and from affected properties should be limited to reduce the risk of moving the virus to other Hendra-free locations. Hendra virus is spread by flying foxes, so particularly in Queensland and New South Wales, horses should not be kept in environments that attract these animals. SA is yet to record a case of Hendra virus, therefore a case in SA would likely be due to transport of infected horses. Due to its high pathogenicity and risk to human health, Hendra is a notifiable disease. If a case is suspected, it must be reported immediately to the Emergency Animal Disease Watch hotline on 1800 675 888. Vaccination using Equivac Hendra virus vaccine is strongly recommended in high-risk states. Equivac is a subunit vaccine containing a small part from the virus surface without actually containing the live virus itself. The active constituent is the G protein of Hendra virus. The vaccine should not be used on immunocompromised horses as it does not stop the transmission of Hendra virus but prevents the dangerous clinical signs. Potential side effects of the vaccine include swelling at the injection site, increased body temperature, lethargy, loss of appetite, oedema, skin rash or colic. However, the vaccine has shown no impact on racehorse performance. Despite the possible side effects, vaccination is the safest option to reduce fatalities due to Hendra virus.